Hey everyone, how things going? Nigel here from Phoenix Rehab. Today I want to share with you that I think the probably last of the series of Skier's Thumb, Gamekeepers Thumb, also known as Goalkeeper's Thumb. And the quick recap is that Skier's Thumb, Gamekeeper's Thumb, Goalkeeper's Thumb are basically, I draw my hand already, it's an injury to the ligaments of the thumb knuckle of the ligament inside. So if you look at the thumb knuckle, you can see there's ligaments on the outer side of the thumb knuckle and the inner side. But with regards to skier's thumb and gamekeeper's thumb, it means that the ligament on the inside of the thumb knuckle is injured or fully torn, right? This is a ligament that's closest towards the index finger. And it happens because there's a force that pushes the thumb away from the hand and index finger. And sometimes it pushed too much, the ligament just is either tears fully or it's partially torn or just slightly sprained or slightly micro tear, right? So for some cases, especially for those who elect for surgery, is when either it's too injured, too painful, a patient cannot tolerate the pain, number one, or it's very unstable, such that the joint keep popping in and out, in and out, in and out, and it's not very functional. And or patients still fairly young and patient want to be really active. For example, patients are a basketballer or a person who is actively caregiving, actively climbing, sailing boats. So for this patient, they normally elect for surgery, or if it's really bad, the doctors will push for surgery. Even for me, if I see the patient hand is really bad and will benefit from surgery, I also will recommend for surgery. But 95%, 96% of the time, patients do not need surgery. This video talks about hand therapy after skier's thumb surgery, right? So there's three phases generally. You can see the top image over here. So for the surgery, the doctor will open up the area here where the ligament is injured, and then they will I mean, of course, you'll be sleeping, and then they open up and then they repair the ligament depending what kind of injury it was. If it's the ligament snap in the center, they'll tie the ligaments back. If it's the ligament insertion point, they'll nail the insertion point back typically, right? And then for the first, from day 0 to the end of week 2, which is 14 days, we do a lot of wound management, range of motion management. However, um, we will also start at the same time. If possible, we do night splinting. It depends on whether the patient's wound can take night splinting or not, or day splinting, because sometimes when you wear a customized splint, you can see this image over here, right? Let me see, where am I? Here, over here. Sometimes if you cover a close over the wound, it can cause it to be wet, and we don't want the wound to be wet. That can cause a delay of wound healing. So during the first 2 weeks, we focus on wound management and make sure that the range of the thumb is full. We don't need to get stiff. I always tell my patients, surgeries, when done well, gives you the best outcomes and the most certain outcomes, because sometimes if you leave it conservatively, you do not know how long it will take. So I can tell you with very clear dates and numbers. First 2 weeks, post-surgery, we do wound management, range of motion. Okay, week 3 onwards, when the wound has closed, we'll start night immobilization. This to make sure that at night your hand don't get stuck with either you scratch yourself or your hand don't get stuck with your blanket and you accidentally pull your thumb again. And then we continue doing the range of motion stretches, and we start ultrasound therapy to accelerate the soft tissue healing. Of course, we will start with heat treatment and scar management as well, because anytime when there's a surgery, there's a wound, there will be a scar. And scar will always, when it will close up, right? But you also shrink. So with this shrinkage, it causes stiffness at times. So you want to stretch it out without too much stretching, because too much stretching will cause it to have too much inflammation. So it's very gradual and controlled therapy actually. So that's from week 3 to all the way to week 8. So this is end of month 2 already, post operation. Then the beginning of month 3, if the ligament is strong, if wound has healed, scar is healing well, patient is doing well, the range of motion is doing really well, that's when we start strengthening. We do a lot of gripping, pinch strengthening, flexion strengthening, extension strengthening, abduction, adduction strengthening, a lot of dynamic strengthening with gripping, pinching, pulling, so that we load the ligament, load the hand, load the thumb, such that your tendons, your ligaments, your muscles, your joints will also develop in strength in tandem with your ligament healing. And this will ensure that your thumb strength, your thumb ligament strength will be good, and all the strength will work together when you use your hand for whatever task you want to do, be it for cooking, for climbing, or whatever. And strengthening would typically take at least 4 to 12 weeks, depending how aggressive your activity gonna be. For example, if you're just gonna return to something mild, like swimming, solo sports, or cooking, it's not as hardcore as you say, hey Nigel, I want to do sailing, competitive sailing, So expect strengthening to last anything from 4 weeks all the way to 12 weeks or even longer. It depends on what you need. But that's in a nutshell what we'll do for hand therapy following a skier's thumb surgery. So if you have any questions for me, just reach out to me, comment down below. Let me know how I can help you, how my team can serve you. We are here for the long term. So talk to you soon. Take care, guys. See ya. Bye.